Good day. I am Dr. Rinaldo Hoson. I was asked to give a lecture with this title, Organization and Management of a Department of Surgery for HA 202 with a time limit of 45 minutes and with the following prescribed learning outcomes or objectives. One, understand the philosophy, objectives, structure, staffing, policies, systems, and methods in running the Department of Surgery of a hospital. Two, understand the roles and relationships of different components of a Department of Surgery. Three, describe the responsibilities of hospital managers in directing and coordinating the Department of Surgery. And four, understand the challenges that might be encountered in the Department of Surgery and to recommend solutions thereto. I will use this generic department design and development framework, which is essentially an administrative design and development program to tackle learning objectives 1, 2, 3. I said this framework is generic and is applicable to all kinds of departments in the hospital. As such, this is applicable to a department of surgery. The Department of Surgery is one of the various medical specialty departments providing medical surgical services to patient clients of the hospital. The Department of Surgery is one of the subsystems within the hospital, which is the super system. The other departments are co-subsystems. Using the framework, this slide shows the essential and basic components of the Department of Surgery, which must be present to facilitate accomplishment of its authorized functions and services and achievement of its goals. See the various boxes with the following labels: leadership, authorized functions, authorized services, goals, architectural design and engineering construction, physical structure, DOH licensing and structural requirements, policies and procedures, risk management system, human resource program, equipment material program, data document records program, business development program, budget program, IT-enabled system, regular performance evaluation, and continual improvement program. All of these components must be present, aligned and integrated with each other in order to achieve performance excellence for the department. The arrows indicate the need for alignment and integration of all parts of the department. On the extreme left of the slide, one sees the need for alignment and integration with the whole hospital as well as the other departments in the hospital. This slide illustrates a super system, which is the hospital, subsystem, which is a particular department, and cost system, which is an interfacing department. Again, all the arrows indicate the need for alignment and integration of all parts of the subsystem, the department, with the super system, the hospital, and the cost systems, the interfacing departments. Let me repeat, the administrative design and development program should be aligned and integrated with the whole hospital's concept and design, governance, policies and procedure, whole hospital's operations, policies and procedure, as well as the interfacing units, operations, policies, and procedures. In other words, there must be a systems perspective or systems thinking. Leadership. There must be a competent head with at least the following competencies: unit technical requirements or competency on the specialty of the department. In other words, the head must be a surgeon. Hospital teamship or team playership, managership, and leadership with systems approach and thinking in management. There must be documents that contain the job descriptions, job specifications, and performance evaluation system of the leaders and managers. There must be a document stating the authorized functions of the department. It must be complete and clear with general and specific functions, and it must be authorized by a higher office. This is for the function. The authorized functions serve as a compass or guide, describe roles and responsibilities of the department in the context of the whole hospital, give it authority to do what it should be doing, serve as a guide in determining what are needed in the unit to function properly and adequately, such as in terms of structure, staffing, policies and procedures, programs, and resources. Serve as guide in determining what programs, projects, tasks, and activities the head and staff can do to accomplish their unit's functions, both on long-term and short-term basis. Serve as basis for evaluating unit's performance at the very least, whether it is accomplishing its expected functions on a daily basis and annually, and serve as a basis for the name of the unit. Example of general function: to provide medical services to all patients with surgical conditions and diseases who seek consultation and treatment in the hospital. Specific functions: example of the list: 1. To examine all patients with a possible surgical condition and disease, and after which to make a rational and accurate diagnosis. 2. To provide treatment to all patients with surgical conditions and diseases. 3. To provide training in surgery. And 4. To promote research in surgery. Another example of these of specific functions: 1. To provide quality health promotion and disease prevention program in the field of surgery to clients in need of such service. 2. To provide quality and safe diagnostic and therapeutic procedures to all patients with surgical problems. 3. To provide quality and safe preoperative, intraoperative, and postoperative surgical care to all patients in need of such healthcare service. And 4. To provide quality rehabilitative health programs in the field of surgery to all clients in need of such service. Services: there must be a document stating authorized services of the department. Formulated functions determine the services to be offered to clients, both physicians and patient clients, and services offered and functions authorized must be congruent with each other. Example of a list of services based on authorized functions: diagnostic program, therapeutic program, preoperative, intraoperative, and post-operative surgical care program. Another example: health promotion and disease prevention program, diagnostic program, therapeutic program, preoperative, intraoperative, and postoperative surgical care program, and rehabilitative health program. Goals: there must be a document stating the goals of the department, which are usually the following: performance excellence, client engagement, quality and safe healthcare services, cost-efficient and value-based services, and maximal utilization of services. Ultimately, all of these resulting to financial viability and sustainability of the department. Value-based services mean value created and appreciated by patient and physician clients for services rendered as a result of good outcomes and results in quality and safe services and associated with reasonable cost and expenses. There must be a document stating the ultimate goals of the department, which must be aligned and integrated with the goals of the hospital. All the department's goals should eventually be contributing to financial viability and sustainability of the hospital. Physical structure. Physical structure of surgery department refers to a geographical space or area in the hospital constructed to receive patient and physician clients requesting for services and to house the staff who will perform the functions of the department. Physical structures needs of surgery department as dictated by functions and services include the following: operating rooms, surgical patient beds or floors, consultation rooms in the outpatient department or clinics, and emergency room, and department administrative office or offices. The surgeons or the department leaders must be involved particularly on the design and development of the operating room, surgical patient beds, consultation rooms in the outpatient department and clinics and in the emergency rooms, as they have impact on its authorized functions and services. These departments and services are usually managed by different groups of managers. The department leaders must take note of this. Service requirement as dictated by authorized function is the first determinant of the physical structure of the department. The department leaders must also take note of the other requirements and determinants of physical structure: statutory and regulatory requirements, DOH licensing requirements, building code, fire code, local government requirements, specialty requirements, particularly on training and research, human resource program, equipment and material program, data documents and records program, budget program, risk management program, business development program, quality standards, community expectations, efficiency, caseload, and owner's wants. The physical structure of the department service areas must be compliant with DOH licensing and structural requirements, particularly on location and size. In particular, they must comply with the following: accessibility with clear signages, adequate size, not cramped for staff and client movement, adequate lighting, adequate ventilation, aesthetics being attractive and with a welcoming, friendly, and therapeutic environment, provision of privacy as needed, and comfortable waiting areas. Architectural design, engineering, and construction. These will be dictated by the DOH licensing and structural requirements and the physical structure requirements. Human resource program or staff. This consists of MDs or physicians, surgical consultants, fellows, residents, and interns, etc., providing medical surgical services on a salaried and/or non-salaried basis. The specialists usually consist of consultants in general surgery, pediatric surgery, urology, thoracocardiovascular surgery, plastic and reconstructive surgery, neurosurgery, and other subspecialties. There must be documents showing job descriptions, job specifications, and performance evaluation system of the human resource in the department. There must be documentation of adequacy in number and in competency. Equipment material program. There must be a document showing adequacy of equipment and materials needed to facilitate an effective and efficient functioning of the unit in consideration of the key functions and services, statutory and regulatory requirements, and other objectives like business development, risk management, and IT-enabled system. There must be a document showing adequacy of the equipment and materials in the following service areas: operating rooms, surgical patient beds or floors, consultation rooms in the outpatient department or clinics, and emergency rooms, and department administrative offices. There must be documents showing the presence of management system of equipment and material program, which include, among other things, preventive maintenance and calibration, especially of precision biomedical equipment. This is for the equipment material program. Data documents records program. There must be documents showing adequacy and accuracy of data, documents, and records needed to facilitate an effective and efficient functioning of the unit in consideration of the key functions and services of the unit, statutory and regulatory requirements, and other objectives like business development, risk management, and IT-enabled system. There must be documents showing adequacy and accuracy of data, documents, records needed in the following service areas: operating rooms, surgical patients' beds or floors, consultation rooms in the outpatient department and clinics, and emergency rooms, department administrative offices. Examples are patients' records, governance, operations manual, and department statistics, and others. Business development program. There must be documents showing the presence of a structured and comprehensive program that will develop the business of the unit to make it viable and sustainable. Budget program. There must be a document showing a budget that projects future income and expenses of the unit, and the budget is being used as a guide for day-to-day performance and financial evaluation at planned intervals. Risk management program. There must be a document showing a risk management program, which is a planned and systematic process or program to reduce and/or eliminate the probability of a risk that usually results in injuries, losses, and legal suits. The program may also include risk with potential positive effect, not just the negative effect, such as improving business and client engagement. IT-enabled system. There must be a document showing the use of computer technology or IT to promote efficiency in performance of functions and accomplishment of services, to manage information of unit such as getting, storing, protecting, processing, transmitting, and later retrieving as necessary, to create interconnection with other units in the hospital for timely communication, coordination, and collaboration in accomplishment of services of the unit, and to communicate with the patient and physician clients both in and out of the hospital. Policies, procedures, clinical practice guidelines, and clinical pathways. There must be documented policies and procedures, clinical practice guidelines, and clinical pathways that serve to provide order, to promote standardization, to facilitate communication, to promote effectiveness and efficiency, and to provide a guide to present and future staff, among other things. Policies and procedures must be aligned with those of the hospital. They should be reviewed and revised periodically. Clinical practice guidelines and clinical pathways are akin to policies and procedures but focus on patient management. Clinical practice guidelines is defined as systematically developed statements built on synthesis of evidence, which provide formal recommendations about appropriate and necessary care intended to assist the practitioner and patient to make decisions about appropriate health care for specific circumstances. Examples of titles of CPGs are CPG on acute appendicitis, breast cancer management, gallbladder stone management, etc. Clinical pathway, on the other hand, is an interdisciplinary plan of care that outlines the optimal sequencing and timing of interventions and expected outcomes for patients with a particular diagnosis, procedure, or symptoms. Examples of titles of CPAT or clinical pathways are CPAT on acute appendicitis for operation, elective cholecystectomy, etc. The last box, regular performance evaluation and continual improvement program. There must be a document that shows a program to appraise extent of accomplishment of the unit in its authorized functions and business plans that plan intervals, such as quarterly, biannually, and annual, and to determine areas of improvement and to act on them. At this point, I'd like to say that I have covered the learning objectives 1 to 3 using the department design and development framework. Number 1, philosophy, objectives, structure, staffing, policies, systems, and methods in running a department of surgery. Number 2, roles and relationship of the different components of a department of surgery. And lastly, responsibilities of hospital managers in directing and coordinating the Department of Surgery. Have I done this? Let's now go to the last learning objective, which is common challenges encountered in the governance of a Department of Surgery together with their suggested strategic solutions. The challenges can be in at least 5 categories: man, system and methods, machine, equipment, money and other resources, and trends in surgery. Under demand categories are the consultants, the residents, colleagues in other units, chief of hospital and other bosses, and of course, the subordinates. The common problems are competencies, quantity, alignment, coordination, collaboration and integration, and of course, personality. Suggested strategies consist of leadership and managership skills, managing your boss, such as managing his personality, to adjust accordingly to his mindset or her mindset and mood. The use of multi-sectoral, multi-professional committee membership to engage everybody into alignment, coordination, collaboration, and integration. Under the system and method category, common problems are lack of systematization in doing things, lack of standardized procedure. Suggested strategies: use the DOH licensure requirements as a guide. Use quality standards as a guide, such as the PhilHealth Benchbook, Joint Commission International, and Accreditation Canada International. Establish policies and procedures. Formulate clinical practice guidelines. Formulate clinical pathways. Under the machine and equipment category, common problems are lack of management system, lack of calibration and preventive maintenance of machine and equipment, suggested strategies, policies, procedures. Under the money and other resource category, limited resources is always a problem. Suggested strategies, leadership, and innovativeness in getting the money, in securing the money. Under trends in surgery category, the most common problem is the rapid changes in trends, which oftentimes are difficult to cope. Suggested strategies are knowledge management system, which constantly track the new development, as well as continual education, benchmarking, and innovativeness. I'd like to end my lecture by flashing again the topics that I have covered. 1, philosophy, objectives, structure, staffing, policies, systems, and methods in running the Department of Surgery of a hospital. 2, roles and relationship of different components of a Department of Surgery. 3, the responsibilities of hospital managers in directing and coordinating the Department of Surgery. And 4, challenges that might be encountered in the Department of Surgery and to recommend solutions thereof or thereto. My parting advice: 1, remember and use this framework. It is generic, it is applicable to all departments, and it is comprehensive. It facilitates learning, planning, and governance of a department. Just put in the details, the contents in each box, and compile them into an operations manual. Remember this starting table with 5 categories: man, system, and method, machine and equipment, money and trends, and recall the common problems under each category and my suggested strategies. You can add more as needed based on your settings and circumstances, particularly on the strategies. With this, I conclude my lecture. I really hope you have acquired the prescribed learning outcomes through my presentation. Thank you for your kind attention.